You just want one by the
Yeah,
podium
that'd be
here?
great, then I can just throw them away when I'm done. Thank you.
Amy? Is Amy there?
Yes.
Amy, this is Bridget Benson. I am having a problem getting on to the go-to meeting on my tablet, but I think it's just because of the reception here within the bank. Is it fine just to be on the phone call?
Yep, that's fine. Just mute us out when you're not talking. That's totally fine.
No problem. Thank you.
I do have 12 o'clock. Are we ready to go?
Brad, are we live streaming?
Yes. I do have 12 o'clock.
Dwayne?
Yeah, we're ready to go at the meeting room.
Okay, go ahead, Mayor.
All right. Good afternoon, everyone. Al, could you start us with roll call, please?
Benson.
Benson, here.
Commissioner Bez is present. Sarda.
Sarda here.
Commissioner Sarda is present. Fertig.
Fertig here.
Commissioner Fertig is present. Hoffner.
Hoffner, present.
Commissioner Hoffner is present. Minor.
Minor, present.
Commissioner Minor is present. Moser.
Mosier, present.
Commissioner Moser is present. Schramm.
Schramm here.
Commissioner Schramm is present. Weber.
Weber, present.
Commissioner Weber is present. Mayor Johnson.
Johnson here.
Mayor Johnson is present. City Manager Leon.
Leon is here.
City Manager Leon is here. City Attorney Denherter.
Denherter is here.
City Attorney Denherter is here.
All right. Before we go on to public appearances, I would, and maybe we should have a motion for this, to add an item to the agenda. When we issued it yesterday, we didn't realize we'd have a recommendation regarding the municipal election. That also came out as a recommendation from the health board last night. So can we get a motion to add that item to our agenda?
Weber moves to add that to the agenda.
Benson will second.
We have a motion and a second. Is there any commission discussion regarding that item? Ross, please.
Having looked at the agenda again, I believe that the agenda item is written broadly enough to encompass this, because it's essentially a line item to consider the recommendations of the health board. So I think it would be encompassed, but I think it's still probably good to have the motion, the vote, just to clarify what we'll be doing as part of that line item on the agenda.
Thank you. Thank you for that. Any more discussion? Al, can you do roll call, please?
This is roll call to add the agenda item. Again, it's just a clarification to make sure everybody else knows that it's on the agenda too. It's part of the broader theme, but we're adding this to clarify for the viewing audience and anybody else. Benson.
Benson votes aye.
Benson is an aye. Sarda.
Sarda, aye.
Commissioner Sarda is aye. Fertig.
Fertig, aye.
Commissioner Fertig is aye. Hoffner.
Hoffner, aye.
Commissioner Hoffer is aye. Minor.
Minor, aye.
Commissioner Minor is aye. Moser.
Mosier, aye.
Commissioner Moser is aye. Schramm.
Schramm, aye.
Commissioner Schramm is aye. Weber.
Weber is aye.
Commissioner Weber is aye. Mayor Johnson.
Johnson, aye.
Mayor Johnson is aye. Motion passes 9-0.
Thank you. Moving on to public appearances. Al, is there anyone in our meeting room who wishes to address the commission about an item not on today's agenda?
Nobody that's talking about anything not on the agenda.
Brad, anyone on YouTube wanting to address something not on today's agenda?
There are no comments or questions at this time.
All right. Then we will move on to new business. And the first thing on the agenda is consideration of recommendations from the City Health Board and an introduction and first reading of ordinance number 1033, which is COVID-19 Temporary Emergency Ordinance number 1, and establishing March 30th, 2020 as the second reading. Do we have a motion in a second?
Do you mind if we go through the ordinance before we do that, please?
We can. And I would actually like to start off with some comments. Where are we today? Where are we with COVID-19 response? Where are we as a society? Where are we as individuals looking to do what we can to help? I think a lot of us are asking those questions right now. The clouds are dark, and there's not a lot of daylight peeking through to give us hope. COVID-19 is spreading through the world, and as we've seen in the last week, especially through the United States, we're scared for our health. We're scared for the health of our loved ones. Treatments and vaccine don't seem to be close at hand. At the same time, we face an economic calamity on a scale none of us probably thought was possible only a month ago. Businesses that people spent their lives building are being closed through no fault of their own. Job losses are mounting. People fear losing their livelihoods, their homes, and their dignity. All of this is terrifying. It certainly terrifies me, especially as I see images and hear reports from Italy, New York, Seattle, and other places hit hard by the virus. And yet I do feel hope. Many people are looking to do the right things. They are staying home. They are closing down or limiting business. In these ways, we can rise to the occasion and push those clouds away to see that there is a future for us all if we pull together. We've got to do our best to spread the rate of infections over a long period of time. We've got to build economic bridges until the pandemic subsides. We've all got to be united in a way that we have never done before in modern times to stay away from each other. So where we are is a place that presents larger challenges than we've faced as a nation in decades. But whether it was world wars, depressions, or pandemics, our ancestors found ways to work together and endure the times that they probably never thought were possible. And that's what we must do now. That being said, let's take a look at where we are now in a more specific sense. Governor Kristi Noem told the mayors of the first-class cities in a phone call today that we have a long road ahead of us. We are just beginning to see the rate of infection increase. It's expected that infections will peak in May, so we've got a good 8 weeks of this getting worse before it gets better. She told us that whatever decisions we make, they need to be sustainable for at least 8 weeks. She said today that schools will remain closed until May 1st, and state employees will work remotely until May 2nd. Governor Noem estimated Monday that 30% of the state's population is expected to get infected with the novel coronavirus. That estimate, which in all honesty could be optimistic, would likely overrun the state's medical capacity if cases are not spread out over a period of months. A 30% infection rate in South Dakota would lead to about 265,000 infections. The Centers for Disease Control and Prevention have estimated that about 20% of people who get infected will be ill enough to require hospitalization. And the most severe cases require intensive care treatment. So that would mean at that rate, South Dakota would have 53,000 hospitalizations. But South Dakota does not have nearly enough hospital beds to serve that level of need. The South Dakota Department of Health currently licenses 11 hospitals statewide that have a capacity of 2,006 beds. And that's according to reporting in the Argus Leader. I know the commission heard that last night, but for anyone tuning in, I think it's important for you to understand the context within which we are working here. Also, for more context, Huron and Beadle County officials have closed restaurants, bars, and other businesses. The Deadwood mayor has called for the voluntary temporary closure of the city's casinos, dining rooms, and bars. The Rapid City Council has had a first reading of an ordinance that would close bars, restaurants, and other recreation-type businesses. And the Sioux Falls mayor is recommending that their health board recommend closure of all non-essential businesses. So I thought that was important just to give us a picture of where we're at today, the environment in which we're making these decisions. And that being said, we have an ordinance in front of us that the health board worked through last night. I was very pleased with all the input we got from our 3 health board members, as well as our ex officio members. Everyone had a lot of good input, and we really hashed through it for about 2 hours. And so we hope it's in a place where the commission feels ready to consider what changes may be needed and whether it's time to move forward. So with that, Ross, I'll turn it over to you maybe to walk us through what is proposed in this ordinance. But you'll have to turn on your mic, Ross.
Turn on your mic, Ross.
Thank you, guys. I apologize for that. This ordinance has 2 parts to it. The first part is a closure of 4 collections of different types of businesses in town. The first recommendation is that effective at midnight on the morning of Thursday, March 26, all restaurants, coffee houses, bars, breweries, dance clubs, gentlemen's clubs, cafes, and any other similar places of public accommodation offering food and beverage for on-site consumption, including any alcohol licensees with on-sale privileges, be closed to on-sale patrons. These businesses may continue to operate, providing takeout, delivery, curbside service, and drive-through services. The list of business types closed by this recommendation would be permitted to be increased by recommendation of the City Board of Health and passage of a resolution by the Yankton Board of City Commissioners. Under the current recommendation, this closure is to remain in effect through Tuesday, April 28, 2020, which is the day after the second regular commission meeting in April, to allow an opportunity for the board at that meeting to potentially continue the closures if that's appropriate under the circumstances. Second group of businesses affected under the same timelines are all recreation facilities, pools, health and fitness facilities and clubs, social clubs, fraternal organizations, athletic and weight training facilities, barbershops, hair salons, nail salons, spas and massage facilities, estheticians, ancillary healthcare services of a non-urgent nature, for instance, non-emergency services provided by dentists, optometrists, chiropractors, etc., movie and live production theaters, event centers, meeting halls, and music and entertainment venues. Again, this list of businesses may be increased by recommendation of the City Health Board and the passage of a resolution by the Yankton Board of City Commissioners. The third group, effective on the same time frames, is all tobacco shops and lounges, vaping shops and lounges, hookah lounges, and other similar businesses which allow for on-site consumption of any product by smoking or inhaled vapor. These operations may continue to offer products for sale to consume off-site under the same conditions as bars and restaurants outlined previously. The fourth group, under the same time frames, is pool halls, video game arcades, video lottery casino operations, bowling alleys, ice skating rinks, and other similar recreational or entertainment facilities must close and cease operations. Just like the other three, that list of businesses may be expanded by recommendation of the City Board of Health and passage of a resolution by the Yankton Board of City Commissioners. We have carved out by recommendation a list of businesses or closures that are specifically not included. That list includes places of public accommodation that offer food and beverage for off-site consumption, including grocery stores, markets, retail stores that offer food, convenience stores, pharmacies, drug stores, and food pantries, other than any portion of such businesses which would be subject to the closure requirements already outlined. That would include like Hy-Vee may remain open, but its deli must close, things of that nature. Laundromats that have a casino in them will need to close the casino operations, but they can continue the laundromat operations, for instance. Room service in hotels is still permitted. Healthcare facilities, residential care facilities, congregate care facilities, and correctional facilities are not included. Crisis shelters, homeless shelters, churches, soup kitchens, or other similar institutions can remain open. Any emergency facility necessary for the response to the current public health emergency or any other community emergency or disaster, and the outdoor portions of any golf course may remain open. This list of exceptions may also be amended by recommendation of the City Board of Health and passage of a resolution of the Yankton Board of City Commissioners. That's the first chunk of regulation. The second part of this ordinance makes it unlawful for any communal gathering, which is a gathering of persons in the same single room or single confined or enclosed space. Any gathering larger than 10 persons is prohibited. We have carved out an exception for incidental gatherings that might occur in public parks, sidewalks, streets, and the outdoor portions of any golf course, parking lots and common areas of any hotel, office building, or residential apartment building, grocery stores, shopping malls, manufacturing facilities, or other retail or business establishments where larger numbers of people may be present, but where it is unusual for people to be within arm's length of one another for extended periods, hospitals, mental health or substance abuse treatment facilities, and medical clinics and facilities, as well as any other location established by recommendation of the City Health Board and approved by resolution of the Yankton Board of City Commissioners. That is the extent of the regulation involving gatherings. A person that violates the gathering limitation or a person who is violating the business closures is subject to prosecution for a Class 2 misdemeanor, which provides a potential fine of up to $500 or up to 30 days in jail, and that would be determined by the court or by the judge. Does anybody have any questions?
One thing I don't see, Ross, is anything with childcare, but I'm assuming that would fall under the 10 people category.
I believe that it would.
Hold on one second. Excuse me, we're sorry for interrupting, but I believe I'd like to suggest we have a motion and second it before we discuss it. I think that'd be appropriate, because if there's no motion, not seconded, there's no use discussing it.
Fair, Jake.
I'll move that we, second. This start a second.
So is that Weber making the motion, Sarda seconding it?
Yes.
Okay, thank you. Chris, proceed.
Oh, I apologize. Anyway, my whole purpose for discussing it first, Jake, is there are some things in this that I would like to discuss and change that I'm not particularly comfortable with. Number one, of course, being the date, the April 28th. Given our situation in Yankton, South Dakota right now, I feel that is extensive. Originally, the date on there was March 14th, which is 3 weeks from today. And we currently have a meeting scheduled the day before that. I would like to have seen that date stay, and we could readjust and extend it that period of time instead of automatically putting a 5-week shutdown on struggling businesses.
I will speak to that concern, Chris, because it's something the health board struggled with quite a bit, and I know Amy especially was struggling with that decision. I will tell you where I came at the subject from is just looking at what we are hearing, what we're hearing from health professionals around the country. The idea that this is going to be a 2 or a 3 week event is not realistic. The governor today, again, was telling us that we need to be prepared for at least 8 weeks of this. So I didn't want to give business owners a false hope that in mid-April they would be able to open again. I think the health board would agree as soon as conditions change and we feel it's safe to reopen these, we will. So, if 2 weeks from now, somehow things miraculously change, we would want to do that as soon as possible. But I just think given what we know now, it's very unrealistic to expect that this will be over by mid-April.
Hey, this is Commissioner Hoffner again. But we have that right. I mean, if this thing turns around tomorrow, and depending upon the vote here, we have that right to meet with proper notice and vote against it.
This is Commissioner Mosier. My question in reading this, and I know you covered it last night during the health meeting. I watched it. I might admit I'm still not understanding it. I agree. I think we need to discuss the date. But Ross, if you could, under number 8, it's very confusing in the ordinance where you're mentioning April 28th in some areas, but then it says June 8th. That's very confusing.
Yeah, okay, so there's 2 separate deadlines that we need to be mindful of here. The regulations that have been imposed as of right now will terminate on the date that you guys select, whether that's April 14th or April 28th or any other date. The regulation ends as of that date unless this organization would vote to extend those regulations. However, there is a final date or a no later than date of June, I think it's 8th or 9th. I gotta look at it here.
8th.
That will be the furthest point that this group could extend those regulations without passing a new ordinance. So if we have a need to regulate into June, by late May, this body is going to want to be looking at a replacement ordinance. That is the ultimate sunset of any of these regulations. Does that clarify that for you?
Yeah, it does. I think it still reads funny, though. I mean, it says this ordinance shall remain in effect until Tuesday, June 8th, 2020, at which time it shall automatically be repealed without further notice. So to me, it still gives the 2 ambiguous dates. I mean, I get what you're saying, but it doesn't say that's a sunset date. And so I think that's where that was confusing.
This is Commissioner Weber, and as a mental health provider and a small business owner, I just feel like I got to give you my 2 cents. That I completely agree with shutting down businesses is a really serious move to take, but we know human behavior tends toward complacency, and as leaders, I think we really need to be aware that we need to have these boundaries in place so that we can help support each other as citizens in this community to be accountable to each other.
Commissioner Minor here. I would like to say, oh, this is hard. There's so much anxiety about what comes next. And as we look at the date to end this, I would like to see us coordinate with the date the governor has given us to go back to school. Because we are piecemealing. School is closed for a week, so you can't send lessons home for beyond a week. And is this business going to close for how much amount of time? I feel like it would, if we're going to consider closing businesses for a period of time, let's do it at the same time the schools are closed. That will relieve so much anxiety for parents who are worried about taking care of their kids, etc. There's a lot of anxiety about that, keeping families together through May 1st instead of that April 28th date.
This is Commissioner Benson. I have gotten comfortable with the whole concept of restaurants and bars and on-sale liquor license, those who are holding them closing or creating a curbside or drive-up option. And, you know, that had gotten to be a little comfortable. We were seeing that around us in surrounding areas. Some of the other ones, I think, are taking it a little bit further than what I see the need for today. At the same time, I realize that in 3 days, we might see that we need to make changes and add in those additional businesses. But I was kind of wondering if we were to go with the first point of the on-sale liquor licenses, the restaurants, the bars, as well as the additional section in regards to gatherings of more than 10 individuals. Could we give time and buy time for some of these other organizations that were spelled out in here, time to get more creative and take additional precautions and continue to keep their doors open to do business, but just a little bit different than they have in the past, to make sure that there are not more than 10 people. You know, as much as we try to isolate ourselves right now, which is healthy and reduces the opportunity for spread, these are also the times where we have to have a sense of community as well. And I guess I'm afraid that if we limit ourselves this much right now today, it's not as healthy than if we just did the first section as well as the gatherings of 10.
So this is Commissioner Schramm. I can understand the point that Commissioner Benson is making. I think we do need to include all of the different businesses that were laid out by the health board. You wouldn't think that there'd be 10 people in a hair salon, but the close contact of individuals in that salon is also an issue, even though there's less than 10 or fewer than 10. So I think we do need to be more prudent and on the side of caution versus step by step, because all numbers are showing that this is going to get way worse if we don't. And I think the reality is we're going to end up making that decision anyway, and it might be just a few days later. So I think we should do this now rather than delay and run the risk of being too late in making those decisions.
This is Commissioner Weber, and I agree with that.
This is Commissioner Sardis. So first, appreciate Amy and the community health board that spent all the time, especially last night, to gather all the information. You're front and center, all the medical information that's out there, what everybody's talking through, and Mayor Johnson, you hit it pretty well. We want to spread this out. You know, if everything happened at once, we would be in some pretty serious trouble. So I like how it's written. There might be a few questions that come up, but if we're listening to all the professionals in their field, the right thing to do is to pass this ordinance.
This is Commissioner Minor.
Commissioner,
Sorry, go ahead. No,
oh, okay. You know, I mean, I think what's difficult here is there is still, even though we define what we mean by some of these businesses, from what I've gotten on feedback today, there are still a lot of questions. If this, if that, what about this? I mean, I think we can all agree, you know, as an elected politician, our first order of business is to protect our community. And that is going to be a difficult decision, and it's going to be at the cost of a lot of services, whether we consider them essential or not. My question is all the questions we're getting today, I feel like this is not black and white, that there's going to be a lot of gray area and a lot of questions. How do we address those? You know, listening to Governor Noem's speech at 11:30, you know, there's phone numbers set up. How are we going to address this as a city with all of the questions? I mean, I'm sure if I'm only 1/9 of the commission and you all got the same number of questions and feedback through text, email, Facebook messaging, there's still a lot of questions, even with an ordinance like this. So how detailed at some point do we need to get? I guess is a lot of my questions. I mean, I wrote questions, I think, next to every line on define this, define that. What does it mean for this type of business? What does it mean for that type of business? I think we need to iron out as well, or do we not, and just let it kind of sit?
If it's not something that is specified in the ordinance explicitly, then it would be a call based on what we have observed in the field. We would probably, if it was a question we couldn't answer ourselves easily, we'd probably then take it to Ross for interpreting the ordinance and help us work through it that way. So yes, if, you know, I think either put the detail in that you would like in that ordinance and be as specific as you can, or know that there's going to be things that come up that we'd have to make a call on. As I am here, I got a text asking about Mount Marty because there's still students in the dorms that maybe don't live, or this isn't their home country, and they're going to be there for a while now. So, you know, the question was that would apply? Well, I think no, it wouldn't apply. That would probably be under the group home type situation, but we didn't, you know, put that explicitly in the ordinance. So up to the commission how detailed you'd like us to be. We can put more language in as well if that's pleases the commission.
This is Commissioner Schramm, and Ross or Amy, when doing research for our city ordinance that you've drafted here, it's my understanding and the research I've done that a broad approach is going to be the most effective, because trying to identify every single instance of exception to the rule would be almost impossible.
Well, I think, you know, Ross drafted the language. He can speak probably to it a little better than I can. I think what we did is looked at what other cities have done and tried to mirror our language with theirs. So Beetle County, City of Huron, Rapid City were some of the communities that we've shared information with, and they've shared their ordinances. Watertown as well, and just like now I've shared this ordinance with other communities as well that you guys are considering. So that's where we took the approach, but we could make it as unique and specific to Yankton as you'd like, or leave it as general as you'd like. We may have to come back to you at some point if it's too general or too specific.
We do have the ability to convene the health board as frequently as we should need to. If we are determining that there's problems with this, we'll just convene the health board and call a special meeting, and this board will be in a position to adjust the list. I think to a certain extent as we go forward, this is going to feel a little bit like a game of whack-a-mole, but it's just, there's too many unknowns as we move forward right now to try to tackle everything that should or shouldn't apply right now, and this is our best guess for the time being as to what is the appropriate group of businesses to close.
Ross, I think what you're saying is we can make a recommendation to the commission as the health board, but we can't change the ordinance as the health board.
That is correct. The board doesn't have any power to do anything other than to make recommendations to the commission, but the commission has power by resolution to change the list of and expand upon the list of businesses that should be closed under the ordinance. Does that make sense?
Yes, and this is Commissioner Schraub again. Ross, would you mind, just for the sake of the listening audience, explain why by resolution would be different than what we're doing here today?
All right, so the key to this whole ordinance working effectively over the next 2 months is the timeframes associated with actions by this board. Typically, when an ordinance is passed, it requires what's called a first and a second reading. It can be done through special meetings, but there is a statutory requirement that the first reading and the second reading be separated by 5 days. So that inevitably delays the time frame in which changes could be made at a time when we may need to act very quickly. So what we've done is, in this temporary ordinance, given authority to the commission to change the parameters of the ordinance by passing a simple resolution. That can be done on a 24-hour notice for a special meeting. So it allows this board to act very quickly. And given our ability to do the web conferencing through this new technology, I think that we can all adapt and act more quickly.
I think we have to keep in mind that we're in emergency management mode here, so we can't let perfection get in the way of the good. I think up through last week, a lot of us expected that it was probably the governor that would take an action like this based on what we were seeing around the country. However, we were notified by the governor on Friday that would not be the case, that if we thought more stringent actions were needed, we would have to do that at the local level. So that's really left us scrambling as we learned that there is community spread just a few counties away, and testing has been limited in the state, so we really don't know the scope of the problem. It's created a sense of urgency where we just have to do the best we can, and we're trying to communicate with other communities to find out what they're doing. So there is some level of cohesion, although this patchwork, I think, ultimately is going to be problematic for our response to this virus effort. I should say, this may be a good time to add, I spoke with Sherry Loest, the Yankton County Commission chairman, today, and she said the county commissioners will be reaching out to businesses in the county, entertainment type businesses, to discuss with them how they will be adhering to the executive order that Governor Noem released yesterday. So I think that's a good start in helping us have some cohesion on our local level.
This is Commissioner Mosier. Good points, Mayor Johnson. I am just a couple things. Again, going back to Governor Noem, she herself on her presentation today said the state has not even defined yet what essential and non-essential businesses are. So we're kind of trailblazing there, which I'm not saying is an issue. But I think as we're working our way through the state, that has not been defined yet. And I guess the other thing that I would want to bring up is we're kind of all over the board here. Is there a way maybe we could work through this ordinance on a bullet by bullet section so we can all kind of discuss questions that we have? I'm sure I'm not the only one that has notes and highlights on this ordinance by section instead of skipping all over to try to have some order to that. Because I think in what you're saying there too is we haven't given our own city businesses a chance to figure out how they're going to adhere to Governor Noem's address. Not that we already know we have local control. I understand that. But I guess I go back to what Commissioner Benson has said, and I know even Commissioner Schramm has brought that up too. We used a hair salon already as an example. So I'm in my mind going, I haven't even given that hair salon a chance to say, hey, is there any way you can adhere to this? Is it that you might have 3 hairstylists and you only work 1 day a week, and so there's only one person coming in at a time? I bring that up only because is there any responsibility for us as city leaders to give businesses on that gray or fringe area that have yet to be defined the opportunity to think about something there as well? I just bring it up as a talking point.
Dwayne, I do have, with your permission, if you make me a presenter, I can share my screen with everybody and we can work our way through the language as a group. If you guys think that that would be the best way to address it, if we're going to make changes, I think that's the only logical way to do it, so that I know that what I've drafted, you guys are all on the same page with.
Commissioner Hoffner here. Now, one way to do this, I think, would be properly is if the commissioner has a bullet point or something to change, offer it in the form of an amendment. And then we vote it, yay or nay. It seems simple to me. Otherwise, we'll be, like Commissioner Moser said, we'll be, spinning our wheels and going on about these points. I know most of us have got a chance to read it through several times. And I think the best way is take a point. If you like the May 1st, make an motion to amend, and if it gets a second, and vote on that amendment. I think that's the best way. Otherwise, we could have different things we'd like to change. But if you think it's valid, bring it up for an amendment.
So does anyone have a specific place they would like us to look to for changes?
So I specifically am still stuck on the date. This is Commissioner Fertig, by the way. I know, Mayor Johnson, you were talking about false hope, and I understand what you're saying, but I think hope is very important. People don't, I think without hope, it's just going to make everything worse. It would be false hope. I think it's a little strong. We don't know what's going to happen in the state. We don't know what's going to happen in our community compared to the state. So I guess I would like to make an amendment to change the dates on 1 through 4 back to April 14th, 2020, and whereas on April 13th, 2020, we can discuss what has happened, and we can expand that at that point if we need to.
We have a motion. Is there a second?
Moser, I'll second for the clarification of discussion.
We have a motion and a second. Is there any discussion of the amendment?
I think this approach, this is minor. I think this approach of going week by 2 weeks by can the business be open, and we have to revisit it, I think causes additional anxiety for everyone. I think our experts are telling Governor Noem plan on 8 weeks. Our experts here, our health board, are recommending 5 weeks. It would seem that if we have these experts, we should listen to them.
this is Hoffner again. Could Al please read back the amendment to make sure for clarification?
Again, I apologize. I think I've got it. It was, the motion was by Fertig was to move to amend the dates in items 1 through 4 from April 28th to April 14th. Is that correct, Fertig?
That is correct.
And Mosier is the second.
This is Commissioner Sarda. You know, I think a lot of businesses have taken the approach to do the right thing and close their businesses carry out only. And I think we should leave it at the April date. April is the 28th, partly because all the information we're getting, this thing isn't going to be here for 3-4 weeks or up to 8 weeks. And don't give people false hope, like someone said, and do it. We might open businesses in 2 weeks, because them businesses need planning too, right? They can't just open their door in a day or two. I would imagine they've got to get people in, get supplies and all that. There's a lot that they have to do. And yeah, I commend the businesses that have closed already to the people coming inside. And to me, leaving the date where it's at is the thing to do.
Ross, sorry, Commissioner Mosier here. Could you clarify how this works, if I guess for my peace of mind, if we would leave it at April 28th, and we get to the meeting on April 13th, and we're all going to love that our glass is half full and not half empty, and we say we lift the date, is that possible to do at the April 13th meeting? Sorry if I don't have the dates right. Or if we're putting the April 28th deadline in here, is that what we're locked into? Or is it up for discussion at our next meeting?
Ross, you need to turn on your mic.
Again, sorry guys. The way it's drafted right now sets an end date deadline. It does not give the commissioners the authority to reduce it. I'll read it to you here. So under paragraph 8, it says any dates identified in the ordinance for closures to automatically end may be extended within the period covered by this ordinance by a resolution of the Yankton Board of City Commissioners. So it'd be a simple matter of changing that to say extended or reduced, and then we'd be fine with that. That was just not something that the group contemplated as we were working it through the meat grinder last night. That would seem like a logical change to make.
Yeah, the Commissioner Mosier here. I think that would make me feel better, that we give ourselves somewhere in here that should, I mean, in all reality, we understand the situation. I don't bring it up that way, but if in 2 weeks we can at least review it and understand that we're good with where we're at, I think that would make me feel better.
Commissioner Minor, again, I would suggest that we consider the May 1st date to coordinate with the governor's plans for state schools, and save parents the anxiety if everything goes back into motion on April 28th, then there's days of childcare and things to be concerned about. I like the idea of a unified, here, May 1st is the date. May 1st is when we'll know. May 1st is when we make those decisions. Or the week of May 1st, it's only 2 extra days.
So maybe that will have to be a separate amendment, I'm thinking, once we get through this one. Is there any more discussion of the amendment currently under consideration? Right. Is there anyone at the meeting at Artec, Al, who would like to comment on this amendment?
Nobody at the moment. If I could interrupt just for a second, though, and I'm going to lean on Ross for his expertise on Robert's Rules of Order, but I'm a little concerned that this is really going to get hard to start voting on separate amendments if we're talking 10 different items. Can we, and again, I'm leaning on Ross for advice here, can we do this by starting with discussion on each item, and then at the end of discussing each item, then come up with amendments? Because right now we're talking about one amendment. We've got a commissioner that's weighing in on a whole nother date. Are we going to start having 3, 4, 5 different amendments just to change the date? So again, I'm just trying to help expedite the whole meeting and the whole process. So I'll turn it back to Ross and get some advice there.
The logistics of this are going to be awfully challenging. I think that it makes the most sense if we tackle just one issue at a time and not change it. Like I suggested earlier, it may make the most sense if I could just put my screen up on there. We could all look at the actual language, if that's not hard for Dwayne to do. Because I know there's a button on my thing here that allows me to share my screen with the group. And as I make changes, they can be redlined for everybody to see. I think that for purposes of the discussion, though, getting a little more directly on point with Al's question here is I think we should vote just on the issue of the dates, because that applies to those 4 first provisions of the ordinance. When the date has been established, not come back to that issue and maybe move on to the next pieces of it. But as it stands right now, there's already a motion on the floor to reduce that from April 28th down to April 14th. I think we ought to clear that motion before we start throwing out other options.
Just for the sake of that discussion, I did reach out at the request of one of you commissioners to Avera Sacred Heart Hospital, to Liz Healy and Doug Ekron, about the appropriate time frame. And the response I received came from Mr. Ekron, and he is saying, you know, we're not really giving specific time frames on this because just of the unknown. So just struggling with the same thing you guys are. I think, you know, he indicated that shorter time frame might be easier, but it may not be the solution. So I just wanted to make sure that the commissioner that asked me knew that I did follow up.
Ross, before we vote, I have another point of clarification. Do we need another amendment to add the word "or reduced" on number 8? Because that might influence my vote.
Okay. I vote that we suspend Robert's rules. I don't get to vote on anything, but I think this is going to be a little bit of a committee discussion while we whittle down this particular language for everybody to vote on. You know, I tend to agree with Steph that the board has a lot more flexibility going forward if you can both extend or reduce, but that's a change to the 8th paragraph, not the first 4 paragraphs. So logistically, if we have a little more flexibility and we're not necessarily hamstrung by Robert's rules through this discussion, it might go a little smoother.
Ross, now I can amend my amendment to include that also. Isn't that correct?
You could, if it's your motion. We have to have the second to prove that as well.
Are you making that motion, Chris?
Yes, I would like to make an amendment to my amendment of the motion to add and reduce to line number 8, or to paragraph number 8.
Stephanie, are you okay with seconding that?
I'm okay with seconding it, but I do need clarification. Sorry, Chris, are you still requesting the April 14th date to be there with the language added or reduced, or are you amending your motion to leave the April 28th and add the or reduced to number 8?
I would go ahead and amend the motion just for the paragraph 8 to add and reduce, and strike the change of date in paragraphs 1 through 4.
Legal point of clarification, I think it reads better if it's an or reduce as opposed to an and.
I'll take your word for that, Ross.
Thank you.
Then Mosier seconds that amendment to the amendment to the amendment.
Yeah, will you clarify that, Ross, just so we're clear? This is Commissioner Weber.
You got to turn on your mic, Ross.
When I'm jumping back and forth between windows, that becomes challenging. Sorry, guys. So, Chris, jump in if I'm reciting this wrong. What you're suggesting is that we leave the dates alone in paragraphs 1 through 4, and instead, in paragraph 8, in the sentence that reads, any dates identified in the ordinance for closures to automatically end be extended, and we would include the words or reduced within the period covered by this ordinance by a resolution of the Yankton Board of City Commissioners.
That is correct, Ross.
All right. Any more discussion? Al, can you do roll call and maybe just for everyone's clarity, recite what we're voting on here?
Okay, and correct me if I'm wrong, Chris, but I believe what the amendment is now is we aren't touching the dates at all. We are merely adding the words, the language or reduce in paragraph 8. Is that correct, Chris?
That is correct.
And Mosier, your second is...
Excuse me, Hoffner here. I believe we need to vote on the amendment to the amendment first, Ross.
Yes.
So now I'm confused. Would you explain that to me, Ross? What are we voting on and what's the amendment?
Okay, well, okay, so this is the first motion that's been on the table. Is that right, Al?
Correct.
So yeah, we're not amending any motion. This is the actual vote. The language changes the vote.
Okay.
Which amendment are we voting on?
So Chris's amendment, seconded by Stephanie, if I'm not mistaken, is now that we put in the or reduced language into paragraph 8. Is that correct? Okay. Al, let's proceed with roll call then.
Okay, we'll begin roll call. Benson?
Benson votes aye.
Commissioner Benson votes aye. Sarda?
Sarda votes aye.
Commissioner Sarda votes aye. Fertig?
Fertig votes aye.
Commissioner Fertig votes aye. Hoffner?
Hoffner votes no.
Hoffner votes no. Commissioner Minor?
Minor votes aye.
Commissioner Minor votes aye. Mosier?
Mosier votes aye.
Commissioner Mosier votes aye. Schramm?
Schramm votes aye.
Commissioner Schramm votes aye. Weber?
Weber votes aye.
Commissioner Weber votes aye. Mayor Johnson?
Johnson votes aye.
Mayor Johnson votes aye. The motion passes as the amendment passes 8-1. And again, while I have the mic here, I want to apologize. My point of trying to keep this a little cleaner by going item by item is not meant to inhibit or restrict any commissioner from amending anything. I just think if we have general discussion, and then after point by point general discussion, then we go into amendments. I think that'll make it a lot cleaner. Again, just my advice. I have no more expertise in this than anybody else right now.
So along those lines, I think everyone's probably fine with the ordinance up until we get into the 1, 2, 3, 4, 5, correct? So should we just say section 1, which is regarding the restaurants, coffee houses, bars, breweries, etc. Does anyone have any issues with that segment?
Is this where I would make my suggestion for the date change?
You're welcome to.
I would offer an amendment that we change the date from April 28th to May 1st to coordinate all of the issues that occur for working families in our community.
I'll second that. Commissioner Weber.
All right, we have a motion and a second that would change this closure will remain in effect through Tuesday, April 28th to now May 1st instead. Is there any?
That is the date that the governor, I haven't seen the press conference. That is the date that the governor announced.
Yes. Yep.
Okay. So just coordinating our local date with the state date for schools.
We've got a motion and a second for that.
Sorry, this is Commissioner Mosier, but it does not correspond with the date she gave state employees, FYI.
What date do they have?
May 2nd is when they would come.
So May 2nd is a Saturday? So state employees would come back to work on a Saturday? I assume school kids would still come back to school on May 4th then, if it's at all possible. I still feel like that gives our working families a chance to better manage the situation.
And Amy, I assume you would want that to apply to all of the following paragraphs as well.
Yes, coordinate our local date with our state date. Is that 1 through 4 where we have dates listed?
Any more?
Excuse me, Commissioner Hoffner here. We should limit debate on this, vote on this amendment, and I want to hear from the public. Get some time. I think we need to move on.
Is there any more commission discussion? Hal, is there anyone in the audience at RTEC who would like to address this amendment?
No.
Brad, is there anyone on YouTube who would like to address the commission on this amendment?
So there are some comments that I think relate to dates. We have quite a few comments. Some of them include dates, but I don't think folks were necessarily responding specifically to the amendments in some cases. How would you like me to proceed?
Generally speaking, are there any comments that would speak to the date? We could take those into account now.
I'm going to begin from the early ones and work my way through as best I can. An early comment by Caleb Kolda said that the date as proposed was very extensive. It should be readjusted if needed. Tina Wilson asks, so if this happens for sure on Thursday at 12 a.m. for us, business and restaurants, Kylie Lemke says, we parents aren't worried about being with our children. We are worried about how to provide for them with 2 weeks, and reevaluating is more peace at mind rather than extending it past the potential April date. I think that's SM Maddie says, I think this is a great idea. Make it May 1st. I think changing the dates to May 1st would be great. Those are the ones I read that are specifically related to dates.
Thank you, Brad. All right, Al, can we have roll call? And please, again, clarify for the commission what we're voting on.
Well, again, I apologize. I hope I'm getting this right, but I believe the motion is that we change in items 1 through 4, we change the April 28th date to May 1st. Is that correct, Commissioner Minor?
Yes, thank you.
And Commissioner Weber, you seconded it. Do you clarify that that's what you're seconding?
Was that a question for me?
That was for Commissioner Weber, who seconded the motion.
I'm sorry, yes, I agree with that.
And as a point of clarification, that change would apply to all 4 groups of businesses, correct?
Yes.
Yes.
Okay, and we'll move forward with roll call. Sarda.
Sarda, yes.
Commissioner Sarda is an aye. Fertig.
Fertig, no.
Commissioner Fertig is no. Hoffner.
Hoffner, aye.
Commissioner Hoffner is aye. Minor.
Minor votes aye.
Commissioner Minor votes aye. Mosier.
Mosier votes aye.
Commissioner Moser votes aye. Schramm.
Schramm votes aye.
Commissioner Schramm votes aye. Weber.
Weber votes aye.
Commissioner Weber votes aye. Benson.
Benson votes aye.
Commissioner Benson votes aye. Mayor Johnson.
Johnson votes aye.
Mayor Johnson votes aye. The amendment number 2 passes 8-1.
Thank you. All right, any more discussion of section 1?
This is Commissioner Mosier. I hate to beat a dead horse, and maybe it's tied to different things. Can somebody on the health board explain why they picked 12 a.m. on Thursday, March 26th as a start date? Because that is tied to a couple of the questions I have for numbers 1 through 4.
I think that was I don't know that we actually discussed the implementation date specifically. It's what Ross included in the draft. And I think all 3 of us felt a sense of urgency about getting this implemented, knowing that community spread has been proven in a nearby county and I think it's fair to say, likely that it's occurring in Yankton County. We just aren't aware of it yet. And so we feel this should be implemented as soon as possible while still giving businesses some time to ask questions and adjust to this. Amy and Dr. Milroy, please add something if you feel I've misrepresented that.
Well, I think this is a good time for Ross to talk to us about the days and the process, by which this can be implemented. Typically, when we have a ordinance, as you know, we conduct a first reading, and then we have a meeting in between. We have time in between, and then we have a second reading, and then we have a 20 days after publication. Well, that timeline can be sped up based on the fact that we're under an emergency situation. So, Ross, maybe you can describe that and how that will really work in practice, and that might bring a little clarity to the dates that you selected.
So the language that was used was the same drafting that was used by Rapid City and Huron in the drafting of their ordinances. The understanding is we want the public to immediately implement these changes. However, even in an emergency setting, an ordinance does not take legal effect with the ability to judicially enforce those provisions until after the second reading. So the sense of urgency is appropriate. I believe here the community is being asked to implement this beginning on Thursday. However, we recognize there's going to be a wind down period that's appropriate for these businesses, and effectively judicial and law enforcement really can't begin until Tuesday, assuming the board approves this at a second reading this coming Monday. Does that make sense? We're telling people that we'd like them to immediately proceed with implementing effective Thursday. Our police and the courts will enforce this beginning Tuesday of next week. That's when the law determines this is legally effective.
It's Commissioner Mosier. So it's kind of clear. It's clear as mud in my mind, in that we have no teeth in this until technically Tuesday after a second reading. So then why wouldn't we just match that date? Because if you're saying it can't legally be enforced, then, and I get the urgency, don't get me wrong, I'm just trying to make sure that I have it all understood in my mind. And I guess I'm just trying to figure out, so then it's a suggestion for businesses to start adhering to this so that everything is in place by Tuesday after the meeting. Is that kind of what you're saying there, Ross?
When the board discussed it, that was the what I believe to be the general consensus. But I'll let the board members speak to that individually.
I think I would want to put it in. Here's what I hope would happen. I would hope that the commission stands together and says, yes, this may not be enforceable by law until Tuesday. However, given the circumstances, we are asking you as community members, as members of our business community, to adhere to our request that this take effect at midnight on Thursday. Just because we do feel time is of the essence here. The longer we avoid taking serious measures to curb people getting together, the easier and more likely it is that the virus will spread in our community and will create problems for not just those people who aren't adhering to it right away, but those who are trying to adhere to it. So I think it's a community issue where we need to ask our community members to adhere to this, even though it may not have the force of law for a few days beyond that.
Commissioner Minor speaking. I believe our community members are searching for guidance, and I think the vast majority of our community members will appreciate the guidance and not worry so much about the enforcement. We may have some outliers, and we'll deal with that once it officially becomes code.
From my perspective, Commissioner Mosier, the thought on the date was, for me, purely that, if we can get compliance before the weekend, that's when I feel that a lot of I just base it off of my habits. I think restaurants and bars are probably busier on the weekends than, maybe not, but likely to be. So that's where I was thinking in that light, knowing that, again, not enforceable till Tuesday, but if we have compliance earlier, weekend is a time when not everyone, but many people can have the opportunity to get together.
Thanks for that clarification. This is Commissioner Mosier again, and it probably relates more to my questions on number 2. So I'll leave it there and then ask when we get to that.
Okay, last call for section 1. Moving on to section 2, and this applies to recreational facilities, pools, health and fitness facilities and clubs, social clubs, fraternal organizations, athletic and weight training facilities, barber shops, hair salons, nail salons, spas, massage parlors, estheticians, ancillary healthcare services of a non-urgent nature, such as dentists, optometrists, chiropractors, etc., movie and live production theaters, event centers, meeting halls, and music and entertainment venues. Any questions or concerns about that language?
I have a concern, I guess, specifically with chiropractors. I think we have a lot of people in our community who it may not be urgent, but chronic. And if we stand in the way of care that they're receiving for chronic ailments, they may see those ailments progress. And I'm not sure how we deal with that in terms of language.
Commissioner Mosier, I'm with Commissioner Minor. That was one of the questions I had on here as somebody who regularly uses a chiropractor, so I'm not bringing it up for my own good, trust me. It's probably a HIPAA violation. It's not chronic for me. I have daily headaches, so I do use a chiropractor to manage those. I guess these are trained professionals. They went to medical school. I guess I'm not sure why we're telling them they cannot treat patients. It's usually a one-to-one. I get some of the other ones in here, and some of them have already closed down to non-emergency, but to leave it up to them to decide if it's a chronic issue and it's somebody that needs to be seen, I'm not sure I'm comfortable with that.
Commissioner Hoffner here. I agree with Commissioner Moser. And I think if I read that correct, if it's urgent, you can sure go to a chiropractor. Am I reading that correct?
Is it?
I think. Sorry.
Go ahead.
You let me last time. You go first this time.
So something in the language, is it urgent if it's a chronic condition? Could you get by for another week or 2 without the adjustment and still be okay, or will your pain increase? I think we have a lot of people that use chiropractors in town regularly for chronic conditions, and I don't know if that qualifies as an urgent condition. That's my question.
My other concern is if, sorry, this is Commissioner Benson, but if you're already limiting their patients that they're taking in, are they able to continue to keep their doors open just for maybe the few who would fall under that emergency type services where they need to come in? And so I just don't know if chiropractors should be in there all the way around.
Yeah, I'm with you. I think, you know, they've been trained in medical school. They know health practices and safety, and I think if they feel they're putting anybody in danger, that needs to be their call. I agree. There's a lot of chronic issues out there that, as Commissioner Minor said, could turn to urgent if some of that continued care isn't given where appropriate. And I think that would be up to a chiropractor's call.
If I could interrupt again just for a minute, out at the tech center, we do have Dr. Tom Stotz in the audience, and I realize that you commissioners want to have some discussion, but at any time, if you want to bring him up, just say so. I mean, he does want to speak too, but I'll wait until you commissioners require him to come up.
I would love to hear from Dr. Stotz. Anybody else?
Same. This is Mosier.
Welcome, Dr. Stotz. Please proceed.
I'm Dr. Tom Stotz from First Chiropractic Centers. That's loud. Based upon information that we have gathered, the Federation of Chiropractic Licensing Boards, the Board of Licensure in the state of South Dakota, as well as our own South Dakota Health Department, chiropractors are considered part of essential care services. When we are open for business, we are able to keep people out of emergency rooms. We're able to keep people out of the medical clinic where there are people that are infected going to. And so we are taking care of those people, and we're essential to be part of that. Because the language in this whole paragraph says closure, that is very misleading to anybody that would read this. Our first impression was our chiropractors going nuts about this because that assumed that meant that we had to be closed. And as I talked to Jason Foote here today, it meant that you could still be open for these emergent cases. Well, that's not what we do. We serve our people for emergent cases, but we also serve them to keep them out of other areas. And so I just would offer the opinion that the word chiropractor should just be struck out of that language altogether, or else form an amendment to allow chiropractors to remain open during this time frame.
I would make an amendment to Section 2 to remove the word chiropractor from non-emergency services. This is Commissioner Mosier.
Commissioner Reiner, second.
All right, we have a motion and a second. Is there any more discussion from the commission on this amendment to strike chiropractors from Section 2? Ross, please.
I have a suggestion that if we're attacking the list, let's maybe let the discussion on that list of businesses play itself out entirely, so that we might be able to just tackle all of those changes in one motion.
If you need permission from me, since I made the motion, this is Commissioner Mosier, I'm okay with that. I almost took on your name, Amy, for some reason.
So does that mean you're retracting your motion, Stephanie, or?
I guess I'm stating, Mayor, that I am fine with holding off on my amendment because I still have, I know, some questions in this paragraph that I may want to attach some other things to that. So I'm okay with retracting that at this point, and we'll keep a note to make sure once we get to the point of amendment, that's included.
So Ross, I have a procedural question. If we have some general consensus to get rid of, to change language, do we need an amendment for each one? Or if everyone just says, yep, that makes sense. It seems to me like in the past, we've just made the change, not necessarily voted on each word change.
Procedurally under, I don't think we need to have a Robert's Rules motion, second, and vote on each change. The problem that we're dealing with here is we're not all together and we don't have a written copy of this in front of us. And the motion and vote does help keep things very organized so that we all know what the document says as we go. Because we're all starting from the same place with the same document in front of us at our individual locations.
All right. So let's move on with the discussion. So far, there's interest in striking chiropractors. Are there any other changes that people feel need to be made to this section?
This is Commissioner Schramm. I've had multiple constituents reach out who operate their hairstylists operate salons, and their concern is that they are self-employed, and if closed down, they have no income whatsoever coming in, and that they feel, although it is close quarters, it's one-on-one, and they are very cleanly and maintain their booth and their station accordingly. So the question is, would the commission consider striking through that hair salons part of this section 2 of this ordinance? And that would be up for discussion, and I understand the recommendation made by the City Health Board.
And just
Commissioner Benson?
Go ahead.
This is Commissioner Benson. I was just going to share that I would support Mason on that as well, in the fact that I think they can very much control the environment of the clientele coming in, keep the doors locked. They could have well checks before they even have the appointment. I think there's a lot of controls that can be put in place so that they can continue to have an income coming in. And it also, there is a little bit of a mental health aspect that goes for some people having the availability to access their salons.
This is Commissioner Schramm again. Would one of the health board members want to state why this was included? Just for the sake of discussion, I understand why we want to limit intimate one-on-one contact for the spread of the virus. So I guess I would just like to hear from the health board a little bit more on this item.
Okay. Actually, just a couple comments. We went through a kind of a long list of these, and I tell you, it was hours kind of hashing through. And actually, as far as I'm concerned, I guess for chiropractors, I thought we were leaving them with healthcare providers, so I have no problem with that. The issue that we discussed really in quite a bit of detail last night as far as hair salons was our concern that in China, it looked like about 80% of their infections were from non-symptomatic people that were just circulating, and that it is highly contagious and that is close one-on-one contact. And our concern was that it appears that this COVID-19 is about 20 times more infectious than our average flu. And with such a high number of asymptomatic people that are very contagious, our concern, and also the other issue was how items that are touched can be infectious for quite a long time. Doorknobs, counters. I know that the hairstylists are very careful about their hygiene, cleaning their equipment, cleaning their sinks. I don't mean to imply that they're not. I just mean that this kind of droplet and contact is highly contagious. So if that person was in the salon and then the next person came in, I guess we just had a concern that maybe that wasn't quite so urgent and perhaps that service could be postponed. So I think that was our thinking in the high risk of infection in that setting. So,
yep, I think that captures our discussion last night. And in other places, they've definitely been shutting down hair salons and barbershops, I'm sure for these reasons. So in my mind, I would caution everyone. I know we would like to make exceptions for everyone. However, that kind of starts defeating the purpose here, because the problem with this disease is it's like we can sit there and watch it in real time spread. So it's kind of hard to wrap our heads around that. But the fact is, the more we allow people to get together in close quarters, the more likely it is for this infection to spread at a faster rate. And so I would really ask us to reflect on Dr. Milroy's explanation as to why they are included. Thank you.
Amy Miner speaking momentarily. I love my ladies. I love my ladies at the salon. I want them safe. And I want all of us safe. And I think in that kind of setting where you are in immediate one-on-one contact, the only way you could, you can ensure safety at this point, but you would want them in PPE. And I don't think at this point, given the shortage of PPE that we have in our city, state, nation, that we could justify that as an essential service.
Commissioner Hoffner here. I agree. And if we could go on and pick each item off. But aren't we really saying in paragraph 2 about non-urgent nature, are we really saying that about the medical field in general? Aren't we saying if you don't have an emergency, don't come to the clinic, don't come to the hospital? That's kind of what we're saying here. If you're in dire need of a chiropractor, yes, come, or a dentist, an optometrist. All these can fit into the same category if you look at it. So I think we have to use some common sense as far as our care. If you have an emergency or not, I think that's going to be always a challenge. But I think we got to realize that I think on that same paragraph, we're asking people to stay away from the clinic and the hospital for this, unless it's urgent.
Going to what Commissioner Schramm said, this is Commissioner Mosier. That was one of the groups, hair salons, barbers. And that's the one where I kind of felt, and I brought it up earlier, if we've really given them a chance to put a plan in place, again, I bring it up. If I'm a hairstylist and I only work Mondays and I stagger my appointments so that I have an 8, a 10, and noon, because I'm cleaning in between those appointments, and I'm only limiting my services to maybe a haircut, or I have a pay online, so they pay before they come. I do realize some of them have already closed because they're concerned about the health and the health of their customers as well. That was my only point of bringing that group up is, have we given them a chance? Much like you said for others. I know, again, going back to, and I feel it's funny because some points we're saying, hey, we need to follow the state. And then out of the other side of our mouth, we're saying, hey, the state's not doing enough. Let's do our own thing. So we're balancing both. They were specifically asked about cosmetology in Governor Noem's speech today. And that's when she said, we haven't defined what essential and non-essential are yet. So the state hasn't done that either as it relates to the service. Whether that's right or wrong, I just bring that up.
And this is Commissioner Schramm again, and I appreciate the discussion on this item, and it can be applied to lots of different items on this list. And I wanted to bring it up because I think we really do have to value the input from our medical providers on what, we don't know how this is going to spread. We're not doctors, we're not epidemiologists, we don't know this. So I really want to value the input from all the doctors, medical community professionals that are saying this is what we should do. And so I think their explanation of why this is dangerous for one-on-one contact, even though if you are as safe as you can be, and I liked how Commissioner Miner put wearing PPE as a hairstylist just isn't practical or proper right now when we're having such a shortage. So I think I would like to just state that I fully support the medical advice provided by Dr. Milroy and all the other medical professionals that are out there in the country right now.
I would just make a comment too that hopefully with this we can encourage the general public that they need to use a little bit of common sense about what is urgent and not urgent. So if, say, you are coming to the Yankton Medical Clinic for your 6-month recheck or your blood pressure check or something like that, it is safer for you to stay home. So that I think that if you can safely postpone some of these things, there's a certain common sense to that too. And I actually have heard from some hairstylists too that are actually very concerned about that kind of close contact, and we're actually almost asking for guidance from us to say, back them up on this, have their back on this too. So I think if we err, I would rather err on the side of safety and caution. And we're all kind of new at this. We're all, flying a little bit blind. But I think if we err, it's better to err on the side of caution.
Commissioner Mosier here, thank you, Dr. Milroy, that made me think of another question for Ross. Is part of that guidance that they're seeking here tied to any unemployment benefits that they may receive? I mean, as Commissioner Schramm said, a lot of these people are self-employed. If they have a business that the city is forcing them to shut down, does it open up any services that they would be eligible to apply for that they wouldn't be if we didn't close them down because they're electing to stay open?
I apologize, Steph. I don't know the answer to that question. I can do a little bit of research and try to find out. And that, I believe, is some of the help that I think is coming down the pipe from the federal government, but I just don't have a solid answer for you at this time.
I think that's an important piece of this too. What we're discussing here, these decisions have been made for a week or more in other parts of the country. So it's not just going to be Yankton hairdressers and barbers that are in this situation. It's people across the country. So we really have to put the onus on our federal officials when they are discussing relief during this unprecedented crisis, that they are keeping our Main Street business owners in mind. It's not just the Wall Street and big corporate people. It's the people that live in our towns and support our events and causes that really need the help at this time. So I think that's the other part of this that we have to keep in mind. We look at it very locally because these are people we know, and it hurts us to have to do this, but we're not alone in this. This is a nationwide issue.
Can everybody hear me? Yes? I just wanted to say I envy your position. I don't envy your position that you're having to make these kind of decisions. I don't know that anybody goes into politics to be involved in this kind of discussion. But however, I have to get back to patients that I need to serve. And so I just ask if anybody has any other questions of me before I leave, I'd be happy to entertain those.
Are there any more questions for Dr. Stokes?
No question. I just want to say this. I'm sorry. This is Commissioner Minor. Thank you very much for your input. We really appreciate it.
Thank you for joining us today. All right, we're still in section 2.
Another one related to section 2.
Yeah,
I warned you where most of my notes were. This is Commissioner Mosier. A couple of calls I took today, or Facebook messages, or emails. People have a great way of reaching out, and I appreciate that. Was the concern of closing the athletic facilities and begging not to do that, because that is their physical release during this time. And I get that's Dr. Milroy, you're going to stop me. I know that's as high of a germ potential area. I think we're down to, is it just Great Life open? One of the people that brought it up to me challenged me to go into that building. So now you've figured out my workout routine is lacking. To go into that building, they've actually cordoned off machines so that the machines are within the social distancing. People are running around constantly wiping things down. And I bring it up just because, like I said, it was brought to my attention that this is how some people are choosing to keep themselves healthy during this time. That the ones that are in there are trying to be very cautious of wiping things down before they get on the machine, wiping things down after they get off machines, continuously washing their hands. And they don't have the opportunity at a at-home gym. And that was their concern, that if we take this away from them, they feel like their stress level would go up, because that is their avenue of relieving stress and keeping themselves healthy. So I bring that up. I promised them I would bring it up for discussion, and that's what I'm doing right now.
This is Commissioner Schramm, and I actually had a gym owner reach out to me, and he may have reached out to you as well as Commissioner Mosier, but he encouraged me, even though it would be at strong financial loss, to close gyms, because he feels it's almost impossible, based on the knowledge that we have of how this virus spreads, regardless of wiping down surfaces. It is an airborne virus, and you're working out, you're breathing heavy, droplets are in the air. Now, I may be totally wrong in my limited medical knowledge, but that is a concern, is that even though you wipe down surfaces, it's still airborne because of the way your body functions when you're exercising, and creates a bigger threat inside the airspace of that facility.
Yeah, I think it was probably the same owner that reached out to me, Mason, and that was the ask, that we do close down these facilities. I know what these people are feeling, because that's That was my only release too, but my gym closed down a couple weeks ago, and fortunately the weather's getting nicer. Hopefully it stays that way so we can all get outdoors, go for walks or runs. I just do not think it's wise to keep those facilities open at this time.
Commissioner Minor, I agree with the both of you.
All right, any more discussion of section 2?
Is this where I reinstate my amendment then so that we can move on?
Yes, but let's let Ross speak up first.
I did receive 2 emails, and I assured those individuals that I would forward those to the commission. These people were concerned about tattoo locations. Are those appropriate to be included on the list? Because they are not yet at this point.
My opinion would be yes, they should be included. Dr. Milroy, what's your thoughts on that?
I would say yes. That just didn't come into our minds, I guess, last night when we were working on this, but I would definitely say yes. I mean, that certainly to me sounds elective and not urgent and very close contact.
Right, this is Commissioner Schramm. If the logic that I've been telling people that are a hairstylist, that same logic would apply to a tattoo artist, I would think, because of the close contact.
Mr. Mayor?
Yes.
If there's a point where you'd like to hear comments related to that from the public, we have quite a few.
Is everyone comfortable with hearing some public input at this point? Okay. Go ahead, Brad. Thank you.
I'm going to try to get all of the comments related to the services we've discussed and the other ones in that paragraph or similarly related. I'm going to try to read each of them and pause briefly in between, both because it's going to take me a little time to make sure I catch all of them and also give you an opportunity to stop me if you'd like to address a particular comment. Tiffany, who owns a dog grooming business, is asking whether the ordinance would affect her type of business. Kayla Kennedy asks, are tanning salons included in the businesses that must close?
That's a no.
Kayla Kolda asks, are businesses that only serve one person at a time in this closure? Patrick Detterman says, I would like to know who made the decision that chiropractic is non-essential. I implemented the recommendations from the CDC to prevent spread, and I have also changed my scheduling to keep the number of patients in my office at 5 or less. Kurt Bernard says, one person at a time can't go into a hairdresser, but can wander around Walmart all day. Tina Wilson asks, so is this happening for sure Thursday at 12 a.m., businesses and restaurants and some other things? Kayla Kolda asks or says, salons wear gloves all day pretty much and wear masks during the lash and nail services already. Patrick Detterman says, is it in the best interest of the communities to send people to a health clinic which could be overrun by sick patients that could be treated by a chiropractor? I think related to the salon business, Kayla Kolda says, not everyone has kids and need a couple of weeks of work in order to pay daycare bills. Patrick Detterman says, so my impression is our health board is willing to expose people unnecessarily to infections by not giving people an option to seek other health care options. Kylie Lemke says, will there be help for small businesses at our salon? We're already practicing less than 10 people a day in the area by staggering our day. Again, I think related to this topic, Kylie Lemke says, people without children, what are they supposed to do if they cannot work but continue to have city bills and others to pay for? We need to draft the ordinance according to our area. We are all different. Kurt Bernard, I think this is a different section. Sorry. Jeremy Bassler says, I feel ancillary healthcare services of a non-urgent nature do not fit the category they are placed in. Other facilities and activities in paragraph 2 are elective and recreational in nature. S. Maddie agrees with the comment above. Randy Koosman says, chronic chiropractor discussion, massage would also fall under the same chronic need, post-surgery needs. Someone said remove massage. Jeremy Bassler says, as Tom states, many of the care modalities listed as ancillary healthcare services are board certified and held to a higher standard than spas, pools, health and fitness facilities. Kylie Lemke says, cosmetologists went through safety and sanitation guidelines and medical grade cleaners that we work with before, during, and after each client. Kayla Kolda says, we wear gloves and I wear masks already or limited to one-on-one person. Carla T says, then what about salons who wear masks and gloves? Amy Bailey says, my 2 cents on chiropractors. I wouldn't have been able to care for my children alone at home this week if I couldn't have gone to my chiropractor in Yankton. Someone using the name Kovo12 says, thank you, Commissioner Schramm. I agree. We already have controlled our environment to very few clients per visit. Kylie Lemke says, we have clients wait outside until their appointment to limit people in the salon. We can control the situation. We reschedule anyone who is sick or has traveled. Everyone gets questioned. 90% of Yankton salons are self-employed. What are we supposed to do? Is there something to apply for? Terry Eichelberg says, there is no difference between a hair salon and the several people coming into and out of touching stuff at a bar. If you're going to close bars and restaurants, then the hair salon should close too. Melissa Plath says, why are there no people on your health board representing natural healthcare providers such as chiropractors who are essential to strengthening the body's immune system in a way that medicine cannot? Jeremy Bassler says non-ancillary medical treatment centers operate in a much more controlled environment than those exempt. Craig Sommer says, thanks, Jake. Some will say a bar is necessary as well. The more watered down, the less effective it will be. Michelle Pinkelman says, how does massage therapy fit in this? We also have people come in for chronic issues. Is there a possibility of putting regulation on these small businesses to stay open with chiropractic? Victoria Job says, we could argue that gyms are important for mental health as well. Hairstylists and other places will be hit hard. Let them stagger their stylists and employees. COVO12 also says, thank you, Commissioner Mosher. We have some of the cleanest environments. We are already trained and have practiced clean environments for our hair salons. Ethan Powell says, who would be the decider of whether or not something was urgent? I think it has to be very cut and dry. Common sense doesn't apply to everyone. Craig Sommer says, look who's voluntarily closed and who is still open. You can justify being open, but it just waters down the effectiveness. Michelle Pinkelman says, if these small businesses are told to close, we need to find a way to make sure they can open again after this is all over. Is there something that can be done to do for aid for these small businesses? And some folks have also, I should mention, commented about a variety of topics that I believe are covered later in exemptions, like retail businesses and daycares. I was holding on to those comments until we got to that section. And that's the total number of comments I found related to this paragraph.
Brad, thank you for sorting through those for us and providing the ones that are applicable to this specific portion of our conversation. Commissioners, any feedback based on what you've heard there?
I got a question, Ross. I agree. You know, every blanket ordinance is not going to be is not made for every community. If we pass this as it stands, you know, we take a couple things out here, add a couple things there. If we decide, can we decide to add stuff to it? Say we give the option for a business to approach us with a certain plan, certain instances that they can follow, how they would conduct business. Can we exempt specific businesses with an approved plan that they present going down the road?
Yeah, this is Commissioner Mosier, and that was going to be my question too. Boy, I know it's a slippery slope, and if we make an exception here, and this business gets to, but the next one doesn't because their plan wasn't as good. I understand it's a slippery slope, but I guess that was kind of what I was thinking. You know, some of the bullet points, and I wrote them down as Brad was reading them. You know, if you're talking about, I can't get a haircut, but my dog can, that seems a little silly. You know, like dog grooming and tanning, and some of that isn't essential service. But I do think there's some other ones here that might be worth talking about. But yeah, I have the same thing. What happens with businesses that can put a plan together to address this? And that was my other question too, going into this, is, you know, what we have right now, can we add on to it should something happen? And that was some of the discussions I had with people as well. And I think it really, a lot of my discussions were to bullet two. Nobody is arguing the restaurants and the bars and the things like that. Some of it is this kind of what I referred to earlier as gray area, potentially in bullet two, as it relates to businesses. Like I said, the state hasn't said what's essential and non-essential. That's a gray area because I think many of us could make an argument for a lot of what is listed in area two to be essential or non-essential and what that work plan could be.
Commissioner Minor, I think we have to do our best not to make exceptions. I think, I know everybody here feels this in different ways. These are our neighbors. These are people we know and love, and just see what's going to happen to their business or is already happening is heart-wrenching. That said, the reason we're gathered today is that we're talking about saving lives. And there's no mincing words about that. In New York, I know that they traced 50 cases back to one single attorney's office. One person. And the exponential growth from that is staggering. We have to protect our people. And as much as I want them to be able to enjoy their life and have a haircut and de-stress at the gym, we're all going to have to make some sacrifices here. These are people we know and love, and it's my understanding that the dentists in town have closed for 3 weeks in order to donate their PPE to the hospital. So this won't be what my gals at the salon want to hear, but if they have PPE that they use to do work with clients, they might consider donating to the donating that to the hospital as well at this time.
Ross, please.
To Commissioner Ferdig's question, the way the ordinance is drafted right now, the commission has the power by resolution to increase the types of businesses that are restricted by the ordinance. If you are all in agreement, I can add a provision that allows you to increase or decrease the businesses if you want that level of flexibility. In the same way that we've already extended the ability to increase or decrease the length of time that the regulations apply, we could have a similar change. The list could be decreased if this group was convinced at a later meeting that that was appropriate.
Mr. Mayor.
I would be comfortable with that, Russ.
Mr. Mayor, this is Chief John Harris.
Go ahead, Chief.
Yeah, one of the things I'd like to caution you on, when you start making exceptions specifically to individual businesses, it becomes an absolute enforcement nightmare for us. Just wanted to add that into the mix.
Thank you for that perspective.
Hoffner here. Hey, excuse me, folks. Yeah, this is tough. This is really rough. It's a tough decision, and I agree with Commissioner Minor on all accounts. I think by us being proactive rather than reactive, there won't be a perfect solution, but if we try the best we can, but I think if we can encourage publicly responsibility, using common sense, there's already businesses that have said, you know what, not gonna mess with this. And believe me, I have a business and I'm, I see and feel the needs. And I think it's gonna come down to people making hard choices. But at the end, hopefully they can realize that they can step up and realize what we can do. I look back at what I have seen both nationally and locally, that if we can take steps now, we've already done things proactively. And we've already probably, and Dr. Miller can probably agree that the things we've already done have already saved a lot of, probably even lives. But that doesn't mean to stop. It means to be more active. So I guess I'm going on and on, but I just, very sensitive, and this is tough, and let's I'll keep working on it. Thank you.
Okay, so is there any appetite to amend section 2?
Yes, this is Commissioner Mosher. I would go back and make an amendment that we remove the line where it says, for example, non-emergency services provided by dentists, optometrists, and chiropractors, etc.
Commissioner Mosher, would you be willing to add and decrease in section 2 to not necessarily allow us to make changes, but give us the opportunity to at least discuss that possibility if something comes about?
Absolutely. I'm fine with that. I didn't know if that could be the same amendment depending on the vote. So that's why I only included the removal of the medical professionals.
Commissioner Mosher, I'm wondering if you might also include include tattoo parlors, and hopefully get us to a point where we're just amending that paragraph just one time.
Sure. Is that also where we add dog grooming, tanning salons, and all the other ones that were brought up?
If the commission is in favor of that, or if you'd like that in your motion, then yes.
Okay, well, hopefully somebody got that straight. So I guess my amendment would be to remove the medical part of section 2 where it references medical services, and then to add tattoo parlors, dog grooming, and tanning salons, and also the ability to increase or decrease services as seen fit.
Commissioner Fertig, second.
We have a motion and a second. Commission discussion. I will say I had the owner of a tanning salon reach out to me who said that he felt that there are CDC guidelines that they can adhere to be safe. I don't know if that's any different from any of these other places we've talked about. Dr. Miller, I don't know if you have an opinion on that.
I think that's one of the ones we didn't really think of, but I would say I would try to make as few exceptions as possible and just leave it there. And just for one word about like optometry, dentistry, chiropractic, in no way did we intend to mean those are not important services. I think what we meant was to try to limit non-essential ones, such as if you're going in for a routine dental cleaning, if you're going in to get an upgrade on your eyeglass prescription, you know, those kind of things. So certainly we didn't, I don't think anyone on the health board seemed to say that any of those people are not important and quite important in many people's lives. But just to the, I guess maybe we didn't do it perfectly, but I think what we meant to say is that cutting down things like going into maybe have a routine dental teeth cleaning can wait. If you need to upgrade your eyeglasses, maybe that can wait and things. So I don't think we meant to, you know, say anything derogatory about those or that they're not necessary. So just to make sure that that we weren't misunderstood on that. And I would lean towards trying not to pick out too many exceptions because I think it will water it down. So.
Commission discussion?
Read back the amendment one more time.
This is Al, and I apologize if I've got this wrong, but I believe Commissioner Mosier talked about removing all of the language that talks about ancillary, hang on a minute, I'm finding it again. Ancillary healthcare services of non-urgent nature, we're taking all of that out. And a little bit further on, we're adding the word increased or decreased by recommendation of the City Board of Health. Is that correct, Commissioner Mosier?
That is correct. And then the addition of the other services that we mentioned.
Yeah, I apologize, and I forgot to add that on. And you also added tattoo parlors, dog grooming, and tanning solution or tanning organizations. Correct?
That is correct.
And Fertig, your second is, you agree with all that language?
That is correct.
Okay, and now are we ready for a vote?
Nope. Al, is there anyone in the meeting room who would like to offer comment on this amendment?
There's nobody left now.
Thank you. Brad, anyone on YouTube who has input on this amendment?
Yes, I think there are a few points of clarification you might have made, but I'll ask them again. Kayla Kennedy says, are tanning salons included in this closure?
They would be under this amendment.
Massage, Kristen Meyer says massage also?
Yes.
Jeannie Sukhavati says, are tanning salons not included, which you answered. Kovo 12 says, if salons are closed, every business other than essential services should be closed. Please have a financial plan for those who are self-employed. And again, there are several comments about areas that I think are addressed later on.
Okay, thank you. Any feedback from the commissioners based on the input we just heard from you two? All right, Al, let's vote.
Okay, and bear with me. Again, we're voting on Amendment 3, which was restated. Hopefully everybody's got that, so I don't have to try and muddle my way through that again. And we'll begin the roll call. Fertig.
Fertig votes aye.
Commissioner Fertig is an aye. Hoffner.
Hoffner votes aye.
Commissioner Hoffer votes aye. Minor.
Minor votes aye.
Commissioner Minor votes aye. Mosier.
Mosier votes aye.
Commissioner Moser votes aye. Schramm.
Schramm votes aye.
Commissioner Schramm votes aye. Weber.
Weber votes aye.
Commissioner Weber votes aye. Benson.
Benson votes aye.
Commissioner Benson votes aye. Sarda.
Sarda votes aye.
Commissioner Sarda votes aye. Mayor Johnson.
Johnson votes aye.
Mayor Johnson votes aye. The amendment number 3 passes 9-0.
Okay, everyone, we're just over 2 hours in. Do we need to take a quick bathroom break, or does everyone want to keep soldiering on? What was that, Amy?
I would love a momentary break.
Okay, let's adjourn for just 5 minutes. So I'll see you back at 2:10.
Thank you.
Thank you.
We just leave everything up, right? We don't have to log out and log back in. Everybody can just make sure their mics are mute and we can take a break.
Yep. Yep.
Okay.
Hey, Ross, do you want to call myself?
to get the discussion.
Hey, Mayor.
Yes.
This is Commissioner Weber. I just wanted to share a message that I got from text. Pastor Jeff from Trinity Lutheran Church is praying for all the commissioners and for the citizens of Yankton. He says, be safe, wash your hands, don't endanger the health of our elders with people at risk, and keep us safe by this precaution of social distancing. And we will get through this together. Just wanted to share that from Pastor Jeff at Trinity.
Thank you for sharing that. All right, so we are on to section 3. This would include all tobacco shops and lounges, vaping shops and lounges, hookah lounges, and other similar businesses which allow for on-site consumption of any product by smoking or inhaled vapor. So that's what those would include, or that section would include. Any discussion of section 3?
This is Ferdig. I'm okay with that section as it is.
Al, is there anyone in the meeting room who has input on section number 3?
Nobody currently in the meeting room.
Brad, are you seeing any commentary on YouTube about section 3?
I don't see any comments or questions about that specific section.
Wow, that was an easy one. Hearing no further comment, we'll move on to section 4. That would include all pool halls, video game arcades, video lottery, casino operations, bowling alleys, ice skating rinks. We should maybe say indoor ice skating rinks, and other similar recreational and entertainment facilities. Any discussion on section 4?
This is Commissioner Mosier. I do have clarification. One of the businesses asked me if they have a casino lounge inside their gas station. Does that mean that they then close off that room, but the gas station can remain open?
That is how I interpret it, correct.
And I guess to clarify, because I know this was brought up earlier, basically any business that has a casino room would be needed to be blocked off from the public, is what you're saying, Ross?
Correct. Or the machines could be unplugged.
So this is Commissioner Schramm. So convenience stores with the video lottery, to go with what Commissioner Mosier is saying, that would be blocked off or unplugged. Taking a step back, and I apologize, convenience stores where people gather to have coffee, but they're not a cafe or they're not a restaurant per se. How do you handle that situation legally, Ross?
To the extent that they're buying food for on sale, they would be barred for that purpose under the first provision of this ordinance. Only off sale is permitted. So if they're buying coffee, they need to leave with it.
Commissioner Schramm, again, thank you for the clarification.
That brings up a good point, Commissioner Schramm. What about like gas stations that have food? They do fried food, so I can go in and get chicken strips and fries. As long as I take that to go, they can still serve that?
That's how I'm interpreting it.
Thank you. Those were just a couple of the questions I got to clarify how this ordinance will read and what will be enforced.
Is everyone okay if we just add outdoor skating rinks? I don't know that, or excuse me, indoor skating rinks. I don't know that outdoor skating rinks will be an issue anymore this season, but I would ask that we just add that then, Ross. But does anyone have any more sweeping things that we need to make a motion for? If not, I would ask Al if there's anyone in the meeting room who would wish to comment on section 4.
Nobody in the meeting room at the present time.
Thank you. Brad, anyone on YouTube wishing to comment on section 4?
I have 2 comments, actually I think 3 comments now. Carly T says, what about people who have weddings in April? The next question references a different paragraph, but references casinos, which is why I'm going to read it. Kurt Bernard says, Section 6B, any business to continue if they follow the 6-foot rule, ? All businesses ? It is no more risky to bowl or casino 6 foot apart than go shopping at Walmart or Ace for non-emergency fluff items. And then someone, Raymond Solberg asks, clarification for section 4, churches are exempt but still need to comply with the section 6A 10-person rule, correct? And Chris Kramer says, for video lottery, what if a business has a room but the majority of revenue is from sales? And those are the comments I see right now.
What? There were a few questions there that I think we could have answered. I should maybe interrupted you, Brad. But now I forget what that question was.
Let me go back and see if we can get you again. Carly T says, what about people who have weddings in April? I think this is related to
I think that's going to fall under the 10-person rule. So anything over 10 people, we're saying no.
The next question relates to it because it includes bowling and casinos, I believe. Kurt Bernard asks, Section 6B, if any business to continue if they follow the 6-foot rule, all businesses ? It is no more risky to bowl or casino 6 foot apart than to go shopping at Walmart or Ace for emergency fluff items.
And my response to that would be I get the discrepancy. At this point, I don't know that we want to get into determining what our department stores can sell and what they can't sell. However, I think we would agree that bowling and video lottery are things that people can definitely live for a little while without. So that would be where I'm at on that.
Raymond Solberg asks, clarification for section 4. Churches are exempt but still need to comply with the 6A 10-person rule, correct?
That is correct.
Chris Kramer says, for video lottery, what if a business has a room but the majority of revenue is from other sales?
They would need to shut the video lottery room.
And I believe those are all of the questions related to this section.
Okay.
This is Commissioner Mosier. Maybe my brain is fried already. Where is regular retail in this? As far as like the Verizon store, Maurice's. We talked about the Walmart
downtown stop.
They offer food.
Regular.
No, I support. I was just going to say I support Mosier on this because I am getting questions from your smaller retailers or those who provide a service that are a small business.
And I would jump in here. I have questions about retailers that serve specific needs like Baumgars and Tractor Supply as we're going into season where farmers are going to need supplies.
This is Commissioner Fertig, and I think what the difference that we're talking about, the ordinance today, is not an ordinance for all non necessary businesses like that was included in our original ordinance on the bottom of it. This is just specifically for the first wave. And if we need to go into a non-essential ordinance, that can be addressed at a later point.
Chris, this is Commissioner Benson. I completely agree with you, and that's how I read it as well. Unfortunately, I think some of our business owners who have read it seem to find some of this cloudy, and there's even some people, I think, ridiculing each other within social media because a certain business hasn't closed, and they read the ordinance different in comparison to how it is. So I think this is a good point for clarification.
Traditional retail is not affected by this particular ordinance.
So that brings up another point I had written down later, but since we've brought it up, sorry, this is Commissioner Mosier. Has the health board talked about, and Brad has read several comments, more so from the public since there's not anybody in the chambers. Has there been any discussion? We got large retail, Walmart, Hy-Vee. People are very concerned, and I think they have a valid point that you're as likely to pick up the virus from the hundreds of people that are in Hy-Vee or Walmart at one point than you are the one-on-one in some other businesses. Has there been any discussion? We're leaving large gatherings of people at businesses like that alone right now because it's considered essential?
We did not speak about that explicitly. We were, looking at it the way Commissioner Fertig looked at it from a vantage point of, going to Walmart. Sure, you can buy non-essential things. You can buy non-essential things a lot of places. However, they're selling food. They're selling home goods, things that you need to live your life at home. And you can get away from somebody, make a distance away from somebody. And that's, I think, where we fell down on that decision, although we didn't talk about it, but that's where we came down on it. For me, anyway. The other thing is you always have that opportunity, as Commissioner Fertig indicated. But that's why that decision, the discussion you had earlier about some of those other businesses are fine, because you can get this and transmit this anywhere. I mean, you could be out for a jog by yourself in the park and, somebody runs by you and sneezes. So there is no place that you can't transmit it. Or just, I think the thought was to do something to mitigate or, decrease non-essential movement and congregating and things like that. So that's where my perspective on the health board was.
This is Commissioner Schramm. I think, correct me if I'm wrong, Ross, but the governor's most recent proclamation or executive order encourages large businesses or businesses of necessity like grocery stores to be creative and innovative and find ways to limit the exposure of people shopping there, not standing in a long queue line, for example, to check out. Is that my understanding correct, or is that how you took her proclamation or executive order?
Yes, she made specific recommendations to retail businesses that promote public gatherings, like grocery stores and department stores. Directing them to establish policies where people aren't grouped greater than 10 individuals in one space, and that there's physical separation of at least 6 feet between patrons and things of that nature.
Is there any more discussion of section 4? All right, if not, let's move on to section 5. This one's a little different. Saying these prohibitions and closures do not apply to the following. That would be places of public accommodation that offer food and beverages for off-site consumption, including grocery stores, markets, retail stores that offer food, convenience stores, pharmacies, drugstores, and food pantries, other than any portion of such business which would be subject to the requirements of paragraph 1, referring to, if they have a dining room experience in their facility, something like that. It would also, this ordinance would also not apply to room service in hotels, healthcare facilities, residential care facilities, congregate care facilities, and correctional facilities. D, crisis shelters, homeless shelters, churches, soup kitchens, or other similar institutions. E, any emergency facility necessary for the response to the current public health emergency or any other community emergency or disaster. F, the outdoor portions of any golf course. And looks like we need to make a G, because we have 2 Fs. Any other business type or service established by recommendation of the City Board of Health.
This is Commissioner Moser. I do have a discussion on F. Some of it relates back. Are we saying outdoor golf courses is the only recreational area they can be? You just talked about outdoor ice rinks. We're willing here at the Archery Center to open up the outdoor archery range in the back where people can shoot individually, but that's not listed here. I'm sure there's other outdoor areas or parks or organizational areas like that. So I just wanted to clarify that.
I think that would fall in line with what the health board discussed last night regarding the outdoor portions of a golf course. So no clubhouse activity, but if people are just going to the golf course to golf and are staying apart from one another, that's fine. I think the same would apply to the archery center if they're doing something similar, unless Amy or Dr. Milroy feel differently.
I think generally we felt that a lot of those activities fall into a similar category as a park where you could be by yourself, you could easily maintain distance. And so for myself, I would say archery is the same as golf as far as being outdoors, keeping safe distance. And so, I think we just specifically didn't get to that detail, but we didn't intentionally leave it out. And I would certainly, I guess my opinion is that should be fine.
Yes, I.
Okay, Amy went down. So I guess then my question here would be, do we just need to amend section F to say the outdoor portions of any outdoor recreational area prohibiting, or not even prohibiting, but I was just going to say somehow that there can't be congregational parts to that or something. I don't know. I don't have the exact word.
Maybe you could say outdoor recreational sites where safe distance can be maintained.
I agree with Dr. Milroy. I probably.
Sorry, Amy. I was just going to say I would make an amendment to what she said.
Does everyone feel comfortable with that? If not, I don't think we need to make a motion. I think it's just more of a clarification of what we stated there.
I'm fine with that as well.
Okay.
I have a question, and maybe it's understood. I just want to make sure we don't need to state it. Of course, we are focused on health care for humans. Are veterinary services considered essential? We're going into calving season. I want to make sure that our vets have the freedom to practice as they see fit, and maybe that's understood. But I don't know. I don't know what to say. So do we need to state that or not?
This is Commissioner Schramm. We didn't specifically call out veterinary services as a closed operation. So I think by that admission, we're stating that it is deemed essential at this point. At least that's my understanding.
Ross, you're shaking your head, so that's understood?
Yes, veterinary care is not prohibited at this point in time.
Thank you.
Would you guys like to hear me read back what I've modified in subparagraph F? Make sure you're all comfortable with it. Okay, and F now reads, any outdoor recreational facility where safe distances between patrons may be maintained, i.e. the outdoor portions of any golf course or archery range. Okay.
A bit of clarification on 5A, Ross. Commissioner Fertig. So the way we're kind of reading it, food trucks are going to be still allowed to operate, but are not able to have, say, picnic tables in front of it. Would that be correct?
I would say picnic tables aren't even prohibited, but we still have to make sure people are adhering to the 10 people gathering rule under paragraph 6.
Yeah. Yep. So I understand that, but you were talking picnic tables on private property, which to me would be a sit down and eat an experience, even though it's outside.
Yeah, I would discourage that. Not expressly prohibited.
Any more commission discussion on section 5? If not, Al, is there anyone in the meeting room who would like to provide input on this section?
Nobody in the meeting room at this time.
Thank you. Brad, any comments on YouTube regarding this section?
I have quite a few. They might blend over a little bit into the next section, but there's enough crossover. I think I'd like to read them all with your discretion.
Sure.
Lisa E. asks, are daycare providers considered essential or are they to close? Anthony?
I would say they're not addressed in this, and I think under definitions I've seen of essential businesses, they are considered essential. So at this time, it would be up to their discretion to close. Ross, would the 10-person rule apply to them?
It would.
Okay, so no more than 10 people, so that would, I'm sure, have impacts on our daycares. Is that something we're uncomfortable with?
And that 10, okay. This is Commissioner Fertig, that 10 includes the daycare providers themselves, correct?
That's correct. 10 people total.
Okay, this is Commissioner Benson.
Go ahead, Commissioner Benson. I apologize.
No problem. I am. This one has concerned me the most. When you look at our community, and 3 of our major pillars are agriculture, manufacturing, and healthcare. And these are all industries that are not being shut down. In healthcare, it's a major need at this point. If we are limiting our daycare facilities, which I understand the need, but I don't want to put the idea out there that we want to start closing daycares, because otherwise we are seriously paralyzing our community. I mean, here at the financial institution, at the bank, people have to work. People have to be able to get here. And if you don't have a place to, for your child to be safely and securely, it's very uncomforting. As well as, well, no, I'll just leave it at that at this point.
Yeah, I agree. That's a tough one. I know there is several organizations looking at daycare options to help their employees work at this time. So I don't know if there's any, Dr. Miller, are you aware of any CDC guidance on daycares?
I have not seen a specific recommendation other than in a number of places where I have read daycare services are listed under essential services. And so in reading that, they would be exempt by my reading of them as usually included in essential services, recognizing that our healthcare workers, our first responders, much of what they have carved out as far as financial institutions, manufacturing, agriculture, need to proceed. And as part of that, then daycare is essential. So I guess I would be very comfortable with listing that in essential services.
Commissioner Schramm, there are several large, more than 10 daycare facilities operating in Yankton that serve, I would say, a large majority of the daycare needs in our area. One of those that is not functioning, and the Boys and Girls Club is not daycare, I understand, but a lot of parents send their child to Boys and Girls Club when they're not in session at school. I understand the CDC guideline of 10 people. If we implement that to apply to daycare facilities across the board, there's a huge number of families now that are going to be without daycare because it's almost impossible to find. You're on a waiting list to find in-home daycare services right now, knowing I just went through that with my child.
This is Commissioner Mosier. I understand the CDC guidelines, but part of me thinks we need to exempt that because then what do? You put daycare providers in the situation where we may potentially put our doctors in, and that's the daycare person saying, well, you're essential to go to work, you're essential. I'm at 10, I can't take your kid, sorry, you're going to have to not go to work. I think this is something that this might be an area we look at down the road if our pandemic in Yankton gets worse, but I don't think we can cripple the daycare community right now and then say we still need to have people doing essential services that are going to keep our community moving as well.
I don't know anything about daycare regulations. Is there a child to daycare provider ratio?
Yes, there are mandates on that.
Do we know what they are?
So
not off the top of my head.
This is Dave Mingo. State Department of Social Services regulates home-based daycares at something less than 12.
This might I'm thinking outside the box, but I have seen where there have been companies, businesses, even cities that have taken a structure and created a temporary daycare. That might be something that we could discuss, work through if we're going to have people that are out of work. Maybe creating a temporary daycare. God, City Hall would be a terrible place to do it. But
maybe the Summit Center?
Yeah, or at the library.
Hey, you guys, I just want to interrupt here a second.